you everyone so much for being here. My name is Faith, and like Talia said, I'm one of the social workers here at the Gift of Life Howie's House. And with me is Jessica Cooper. She is a lung transplant social worker at Penn. So again, today's space will be used to discuss the transplant process and its influence on self-image and self-esteem. So today we'll be exploring some social stigmas surrounding transplant and chronic illness. We'll be reviewing parts of the transplant process that impact our bodies, how we identify, and how we view ourselves. We'll also review how these changes might influence how we feel about ourselves, our self-esteem, intimacy, and our relationships, as well as identifying some skills and supportive resources for coping with these changes and these different experiences. So before we get started, I would love to use this space to utilize the chat to talk amongst yourselves, but also to respond to the question of how might you describe yourself right now to someone who you are meeting for the first time. So if you were to introduce yourself in the chat right now, what might you say? So go ahead and share again in the chat, and we'll take a look at that. Please notice others' responses as well. How you might respond. You initially respond and introduce yourself as a transplant patient, a transplant caregiver, maybe a professional. How might you introduce yourself right now?
Also, really quickly, sorry, and I see everyone's able to chat now, but chat was disabled in the beginning by accident. I'm really sorry, but it's available now.
Oh, good, thank you. And I'm already seeing some professional introductions and then some introductions based on where you're at in the transplant process. Great, and I'm seeing some caregiver introductions. So please continue to introduce yourself in the chat, and just kind of keep this in the back of your mind throughout today's discussion as how right now you might primarily introduce yourself or identify. So let's first talk about stigma. We hear very frequently from a lot of patients and caregivers that they believe they experience some social stigma surrounding being a patient, having a chronic illness, whatever that might look like, which can lead to some fear about what others might think of you or how they might view you. Another layer of this fear might come from fear of being pitied. And we can often see that this stigma and the experience of social stigma can often lead to feeling like you are avoiding social interactions or that others might be avoiding you. So, for example, if someone is grieving or if you're grieving, it might often feel uncomfortable, or you might not know how to receive or give support in those moments. So we often find that we might avoid others in these situations. So the next layer of what influences how we see ourselves throughout the transplant process can be both physical and emotional throughout these changes throughout every stage of the process. So let's first talk about some physical changes you might experience throughout this process. So again, we hear this from transplant patients and see this from our families here. For example, weight loss or gain, and this can be due to stress, this can be due to a change in appetite, this can be a side effect of different medications. You might also experience some limited mobility, so you might be having to use a wheelchair or a walker, or might not be able to move the way you used to. Also, feeling like you've lost some control of your body or your bodily functions, especially while inpatient or hospitalized. Also changes in skin. This could look like your skin texture, skin coloring, also scarring on the skin after surgery, also hair loss, and again, the use of any medical equipment. So this could, again, be a wheelchair, a walker, or things like feeding tubes or oxygen. And then any other specific side effects from different medications, which, as I'm sure you know, as your medications change, these side effects might change as well. So changes in your emotional and social wellness can also influence this experience. And this can be, again, both for patients, for caregivers, anyone going through this process. The first example being job loss or career changes. So you might not be able to work anymore, or your abilities in your job or your position in your career might be altered. And this could be due to just not being able to work anymore, not having time to work anymore, or what you're physically not able to do at work or in your role anymore. And we know that this can directly impact our financial situation. So if you are no longer able to work, it's likely that your financial situation and status might change as well. And we know that a lot of people often identify with their career, their financial situation, or just what they do day to day in their job. You also might experience some change in routines, altered or modified hobbies and activities that you're doing day to day. And again, this can be either you no longer have time to do these things, or you're no longer physically able to participate in these activities. And finally, changes in your mental health status. So you might be experiencing some feelings of anxiety, depression, fear. And as we hear very frequently, transplant can feel like a roller coaster ride. So these emotions might come and go. They might be more significant at times. It's going to look different for you and for everyone at each stage of this process. So based on these social stigmas, the emotional changes, the physical changes, how do these factors impact our self-image? So first of all, what is self-image? This is something that I think is very commonly stated, something we hear a lot, but I think it's important to step back and reflect on what this actually means. So self-image can be defined as the idea, conception, or mental image one has of oneself. So if you think back to that initial chat question of how would you introduce yourself right now? How might you identify right now? That can definitely, throughout the transplant process, change and influence how we view ourselves. And all of these physical and emotional changes can definitely play a large role in that. So know that this is very common and very valid to kind of view yourself in a different light throughout these changes. Now, self-esteem, in almost a domino effect, is directly impacted by our self-image. So what is self-esteem? Self-esteem can be defined as our confidence in oneself, one's worth, one's abilities, and self-respect. So how we view ourselves while experiencing change, anything challenging or new, or self-doubt can often lower our self-esteem. And it's been shown that lower levels of self-esteem can directly impact our levels of overall wellness. So for example, if you are not feeling good about yourself, you might experience lower levels of motivation, which might decrease your engagement in things like self-care or things that you really enjoy and feel good about. And then self-image and self-esteem can directly impact a lot of other aspects in our lives. So for example, if we're not feeling great about ourselves, that might influence the way that we approach others, and how we speak and enter a room, how our confidence levels are. Low self-esteem can also increase unhealthy habits. This might include isolation if we're not feeling great about ourselves, utilizing unhealthy coping mechanisms like substances, as well as mental health. So like we said earlier, self-esteem can increase negative attitude, influence our decision making, and again, just impact our overall wellness. So we will now transition into intimacy and relationships and how self-esteem and transplant can impact that as well. So I'll hand it over to Jess.
Awesome. Hi. So like Faith was saying, changes to self-esteem and changes to self-image can lead to changes in relationships. So basically, how you think about yourself and how you feel about yourself can affect how you interact with others, including close relationships in your life. So let's start with what is intimacy. Intimacy is a close familiarity or friendship. It's a closeness. It can be a romantic relationship, a close friendship. It can be a closeness between family members, or really any relationship that's important to you. And the two parts of intimacy that we're really going to focus on today are physical intimacy and emotional intimacy. So what is physical intimacy? It's any touch, really. So it's any, I would say it's any positive touch. It can include hand-holding, hugging, sexual activity, cuddling, or just being in somebody's close personal space. And then what's emotional intimacy? It's sharing thoughts, feelings, dreams, expressing needs and wants, being open and honest, encouraging each other, being interested in each other's internal and external experiences, and really spending time with each other. Okay, you can change it. Okay, so what we're going to go over today, I just want to make sure we have a quick overview of what we're going to go over in regards to intimacy. So like I said, we're going to talk about physical intimacy, emotional intimacy. We're going to talk about some adaptations, about reframing and redefining for yourself. Then we're going to talk specifically about caregiving and intimacy and communication. Okay, so to reiterate what Faith said earlier, some possible physical changes going on post-transplant could be scars. They could be sensitive, painful, or just the way that the scars look. Medical equipment. You could have feeding tubes, a port, dialysis access. Talk about stamina, tiring out more easily, or having more stamina, like after getting a lung transplant, having more air and having the ability to move around more. Body shape, weight loss, weight gain, decrease in muscle, medication side effects, mobility, unable to move around the same ways, or needing assisted devices like canes or things like that. Sexual function, it could be a side effect from the medication or an increase or decrease in sex drive. And then pain and numbness at the scar or referring to other parts of your body. Just as a disclaimer that you always want to talk to your medical team about any changes that you have any concerns about. Okay. So then possible changes to physical intimacy post-transplant. So, how were those physical changes going to impact your intimacy, or how could they? Again, with the stamina, tiring out easily, or like I said, having increased stamina, you could have a very different expectation, or a very different reality than you had previously. Different physical needs, being unable to move the same way, maybe needing shorter interactions or longer times to sort of rest and recover. Working around medical equipment, having to be mindful of feeding tubes, of ports, and that kind of stuff. And then navigating pain, having to figure out what works now that there's pain in your body, or at least pain in maybe a different part of your body, or their pain has changed. And then we'll talk about possible emotional changes post-transplant, which Faith also went over. There's this patient and caregiver roles that are sometimes new to navigate. People, have never been in these situations before. There's a chronic illness mindset. If you've never experienced chronic illness before prior to transplant, it's a whole new world. And, I'm seeing this a lot with folks that are getting transplanted from COVID. That's what I mean when I say I've not experienced chronic illness before, that they, weren't experiencing something, and now post-transplant, they have a different reality. Self-esteem and self-image changes, just like Faith talked about earlier. Anxiety, depression, and trauma could be new feelings, could be increase or decrease of existing feelings. Fear around closeness, fear of being physically or emotionally harmful to your partner in some sort of way. And then fear of pain, being afraid of the pain we talked about, like during physical changes, being afraid that something's going to hurt. And just also for a disclaimer for this is like, talking to a therapist or a counselor can be really helpful with dealing with these changes and with the feelings that come up with them. This is something new that you're experiencing maybe, and, talking it out is really helpful. And then how do these emotional changes affect your intimacy? So, it's difficulty detaching from that patient and caregiver role, sort of getting stuck in those roles and forgetting that you're also a husband and wife or a child or parent or friend. And then fear around body changes and desirability, worrying about the changes, the physical changes might change how, your partner sees you or, or finds you attractive. Different emotional needs, you might need some more encouragement or more grace or patience. And then worries about being able to still share intimacy and worried that it might not look the same way as it did before. And then fear of being a burden, worrying that you're too much or you're asking for too much help and that type of thing. Okay, so we're going to do a quick chat response just, to sort of get a sense of, on a scale from 0 to 5, how comfortable are you at speaking with your loved ones about intimacy changes throughout transplant? So 0 would be not comfortable at all, and 5 is extremely comfortable. And if you want to put in there, sort of a comment, you're more than welcome to as well. We can sort of look and see what folks are putting in. Seems like people are pretty comfortable. And sometimes you're comfortable and your partner is not. No. Awesome. I'm so glad that people seem like they have a lot of comfortability. Yeah. Yep, see, there's improvement. That's awesome. Okay, let's keep moving. Okay, so let's talk a little bit about adaptations, about things that we can do to, to work with what we got and to sort of keep moving forward with intimacy. Take advantage of the good days. Post-transplant patients have good days and they have not so good days. If you think about patterns, you can sort of see what days might be harder. Days that you have doctor's appointments or you're in, physical rehab or anything, those days might be harder. So you might think about, sort of taking it easy on those days and, sort of thinking about the days that you feel better and working with that and thinking about what you like to do on those days. Embracing change, major life changes can be incredibly difficult, but it's not necessarily bad. So this is your body, this is your life now. Like it's not what you expected, it's what you've got. And sometimes being able to come to peace with that can really sort of help you be able to navigate and negotiate this stuff with yourself and your loved ones. Offer grace, for yourself, for your partner, for your body, for your whole experience. It's okay to be patient. There's no need to rush, and there's no need to think that it's going to be perfect every time or anything like that. And then being open and willing and flexible and trying new things, and like they have these intimacy flashcards that help talk about emotional intimacy, something you can like buy online, they're prompts, like making adjustments, adding pillows, changing positions. You always want to talk to your medical team regarding any physical activities. I promise you, like you're not the first person that's going to be talking to your team about intimacy, and you will not be the last. And then even like researching physical adaptations online. I'm sure you can go down like a whole rabbit hole online of finding things. And then remembering that intimacy can happen anywhere. Going for a walk can be intimate, holding hands, any place that you're really sharing a connection with each other. And then these are things that you can sort of do, internally and thinking about, how you're thinking about intimacy and how you're thinking about yourself, that idea of reframing, my body can't do this, I can't do what I used to be able to do, I can't move in this way. And sort of stopping and flipping the switch and saying like, my body can do this. I'm able to do this. I have more stamina, or I'm able to walk longer distances, that kind of thing. And sort of looking more at what you can do instead of like, you're not slapping a smiley face on the front of anything, but you're really just saying, okay, I'm not going to focus on this specific thing that I can't do. And I'm really just going to think about, what I can do and how I can work with that. And then redefining sex and sexual intimacy, it may not look the same, but different doesn't mean bad. And, it's really an idea of like what actually feels good or what actually works for you versus what society thinks things should look like or what TV is telling you things should look like. And like sex and sexual intimacy is more than one thing. It's not, there's so many things to explore and so many ways to be close with one another. And then reevaluating what's important to you and your partner. Having an honest conversation about what parts of intimacy are actually important to you and why, and sort of seeing what connects and how, and having that open communication is really important. And then focusing on specifics rather than the whole, thinking about the big picture and thinking about intimacy, as this big thing can be really overwhelming. Focusing on the specifics and focusing on like the day to day and taking one step at a time might be really helpful to sort of make this seem a little bit less overwhelming and a little more manageable. So let's talk about caregiving and intimacy. So I think that the main thing that we really need to think about is stepping out of the caregiver mode, like making that mental shift, saying like, okay, I'm a caregiver now, I'm going to take off this hat, I'm going to take off the patient hat, and I'm going to, I'm going to be just me. It's like Mr. Rogers taking off his jacket and putting his cardigan on. Like there's like a set thing, and one way to do that is, concretely moving to a more intimate experience, versus like patient and caregiver, like setting the mood, putting music on, low lights, going to a different area of the house if possible. If you take your meds in the kitchen every day, like that might be what, where you're identifying that. So going to a different part of the house might be really helpful where you're not thinking about all of this stuff. And then disregard any non-essential caregiving duties. Anything that isn't essential to health or function can wait. You want to make sure maybe you're not, talking about intimacy when you're right before you have to take your meds or something. So making sure that you're doing everything you can before or after so that you're able to really focus on each other. Tape the feeding tube out of the way. Your provider is going to know the appropriate way of handling medical equipment. And just making it as much of a space as you can that's just about intimacy and not about caregiving. And then carving out that time, like when you're gonna, when you both are not gonna feel great, or there's if it's after PT or after a doctor something or appointment, like I was saying earlier, work around it, but be flexible, know that life happens. And know that everybody's going on this journey together. The caregiver's going on the journey. It's not just the person that was transplanted. Everybody is navigating, navigating this stuff for the first time. Awesome. And then let's talk a little bit about intimacy and communication. And this is something that anybody can use. This isn't like specific to transplant. This isn't specific to anything. This is really good communication in general. So talking in an uncharged environment. So you don't want to wait until you are in the bedroom or the lights are off to talk, or anything like that. Like have a conversation in a neutral, uncharged setting. Go out for coffee, take a walk. Do something where you're not focused entirely on, this act that's, about to happen or something. So you have some space to really process and think about things. I think it's always helpful to ask the other person if they're available and open to a conversation about intimacy. That way you're making sure it's a good time and you're making sure that they're in a good headspace. Because if they say no, then you'll know, okay, now's not the right time. And you can say, okay, well, can you let me know when you're available? HALT, hungry, angry, lonely, tired. So this is borrowed from our friends in the recovery community. So HALT, if you're any one of these things, if you're hungry, you're angry, you're lonely, or you're tired, it might not be the best time to have a deep conversation. Think about what you might need to address these states because you want to be in a good headspace to talk about stuff too. And being any of these four, it's not as helpful. You might have reactions that you weren't expecting or also like aren't true to how you're feeling. And then holiday versus funeral. Intimacy is supposed to be something fun, it's supposed to be exciting to connect people. Talk about it like it's something good, a holiday, versus it's something to endure, like a funeral. Like, I know I can't do anything, you know, I used to be able to do this and I know I can't do this, but maybe we can try this again. Versus, you know, I'm so excited I'm able to do this. Like, let's try out this new thing, or let's talk about this, you know, talking about it in a way that's exciting. Like, this is supposed to be fun. It's not something to endure. And then communication, not magic. So people are not mind readers. They're not able to guess your innermost thoughts. You know, you need to actually express what you want. And the communication, it doesn't make things less sexy, less spontaneous. You know, it's not that your partner just doesn't get you. You have to let people know what you need, you know, especially now you're in a different phase of your life. You know, if you're post-transplant, or, you know, you're caregiving for somebody that's post-transplant, a loved one, you know, you're in a totally different space, and it makes sense to really just talk about what you need and you know, what you're thinking about. And then wants versus needs. So those are two very different things. When it comes to intimacy, it's important to know what a want is and what's a need. Wants are things that you would like or you would prefer. Needs are deal makers and deal breakers. Like, I want you to remind me that I'm beautiful. I want you to hold my hand, but I need you to take pressure off my left side. Or I need you to not ask if I'm in pain. I will tell you if I'm in pain. Like, you don't always have to tell the other person you know, if you're asking for a want or a need, but it's really important to know it for yourself and to know, you know, what's driving you and how you can best communicate it, because that will help you be able to communicate it a little bit easier. And then there's some things to remember, you know, check in, make a plan to check in frequently, put it on the calendar, just, you know, maybe every Friday, you know, after dinner, just have a few minutes where you just talk about how you're feeling and how things are going, you know, and know that, like, your thoughts and feelings are going to change as you get further from transplant and as your body changes and as your experience changes. And then you don't have to let things build up until the resentments. You know, I think it's really important to utilize those communication skills, because you don't need to let things get far so that you're both, like, you know, upset about something or feeling unhappy. Reclaim. So this is your body, and it may have been a long time since you were in control of what happened to your body, especially in the hospital, or, you know, if you were sort of waiting a long time on the list, that kind of thing. You know, you can take control of some things now, and take control of what you can, you know, make it your own, and sort of reclaim some of that piece that you weren't able to for a long time. And then really give yourself credit. Give yourself credit for taking the time to communicate. Give yourself credit for even, you know, thinking about this stuff. It's hard. It can be hard for everyone, and everybody is doing their best. And then lastly, like, now that we've talked about intimacy, like, just a reminder, you know, that how you see yourself and how you feel about yourself can really affect how you interact with others, you know. So I'm going to pass it back to Faith on some tips on how to cope with changes to self-esteem and self-image.
Okay. So with all of these physical, emotional, intimacy, relationship changes, how can we regain control of ourselves, our lives, how we feel about ourselves? First of all, allowing yourself to mourn the things that you've lost. So not necessarily the loss of a life, but these non-death losses, including things like who you may have been or how you may have identified before the transplant process, or things that you were able to do before the transplant process, and allowing yourself to say that this is a loss, this is very challenging, and it's okay to mourn that and grieve that. The next step would be redefining. So redefining who you are today as a transplant patient, as a transplant caregiver, as a support person, whatever that might look like, and redefining that based on what you're able to do, how you identify, and remembering the person first idea of I am an individual who is a transplant patient or caregiver, but I am an individual first. So although transplant is a huge part of my life and my journey, it is not all of my identity. And then mindset, of course, utilizing things like self-compassion, and remembering the strength that you've gained through this very challenging and very new experience. And some specific skills, so like Jess mentioned, communication is so important. And this is not only communicating with your loved ones, but also with your transplant team, with your entire support system, and most importantly, with yourself. So doing a lot of self-reflection, and this can look like mindfulness, this could look like meditations, journaling, whatever is easiest and most natural for you. Also, finding a therapist, like just said, can be extremely helpful in coping with all of these changes. So specifically finding a therapist who might specialize in chronic illness or self-esteem, or your specific diagnosis. And also finally, support groups. So finding a support group, a group of people who might understand what you're experiencing and how you're feeling. So this could again be a transplant support group, a caregiver support group, maybe a support group specific to your diagnosis or what you're going through at this point. But really being able to have that additional layer of support from people who can understand and relate to what you're experiencing. Okay.
Oh, hi, it's Talia. That was really amazing. And just like you had mentioned at the end about like, you know, introducing yourself as, you know, who you are as opposed to just the transplant patient or caregiver. Someone had commented about how it's just so common where people only introduce their loved one as like the transplant patient or caregiver, and it can be really difficult to remove yourself from just that identity. I am excited to introduce someone before we actually get to questions. Stacy, are you still here? Oh, there she is. So Stacy is currently working and is in the emergency response field. So hopefully we don't interrupt her and she's able to talk for a few minutes while she's there. But Stacy is going to share for a few minutes just how how her transplant really impacted you know, what Faith and Jessica have been talking about today. And Faith and Jessica have some questions for her. If you have questions, please put them in the Q&A box and then we'll address all of the questions at the end. So Stacy, thanks for being here today.
Hey, no problem. So I'm a kidney pancreas transplant recipient. I got my donation in March 1st of 2017. I was a type 1 diabetic for almost 20 years until I got some pretty severe complications. And the time of being diabetic, I did have my son. And I mean, since the transplant, I'm a pretty honest person, but I kind of really struggled with what I was dealing with emotionally, like how I was physically going to look. When I went to go have my transplant, the surgeon pretty much told me, hey, listen, we're going to put a scar down from, you know, a vertical scar on your stomach. So, you know, bikini season may not be exactly what you're used to. And I kind of went, well, whatever, I guess you got to kind of choose either a line or a life. So I went with the line. I'm not really a superficial person like that. I don't really care that I have a scar. You know, I usually tell people I got attacked by a bear or, you know, something cool. But then I tell them the truth that it's really my transplant. And honestly, that's, you know, there's no cooler story than that because someone gave the ultimate gift to me. So that's really been a really cool thing in my life. When it came to like really having to deal with it, when I first had it, it was a little bit tougher than what I deal with now. Now I accept it. I had photos done of my scar and I have one specifically hanging on my wall because it's a part of me. It's a part of my journey in life. It's a part of, you know, the beauty that is a part of me now. And, you know, as much as emotional beauty is important, my physical beauty of my scar was also really important to me. I was really worried in the beginning that my boyfriend wasn't going to really want to be so intimate with me because I had a scar and it was, you know, wasn't really considered sexy. And then finally, one day we just had the conversation. He's like, I really don't care what you look like. I do, but not like that. I love you for who you are and our connection is what it is. And it's a scar. And he pretty much told me it made me badass, which #true story. But, you know, we had really deep conversations about it. He made me feel confident about it. And then I just finally accepted that it was something that I needed and it's something that I can't change. But what I can change is how I feel about it and how I look at myself. So I've never really, you know, I don't care what people think when I go on the beach with a bikini. I mean, I have multiple scars from getting my peritoneal port. You know, I have my vertical scar, it goes around my belly button, so it looks like, you know, really super cool, almost question mark. I like it. And I've let my transplant pretty much be a part of my life. It doesn't define me, but I mean, we name my organs Frank and Pank, so they're a part of everyday conversation. So we make the best of it, and honestly, just being really open with it and candid about it has made my life a lot easier to deal with it, because if I'm so uptight and serious about it all the time, I would probably be very depressed, which I was in the beginning. I was really scared about a lot of things. But now I'm back to work full time. I work on my own car. I bought a 65 Mustang. That was my dream car after I had a transplant. So I bought that, and I'm just doing me. And you know, I want other people and other women, men, anyone who's had transplant to know just that, you know, you can make the choice to feel good about yourself because you survived a battle that, you know, it's your specific battle. Nobody else will know what you went through except for you. So that's my TED talk of the day.
Thank you so much, Stacey. I'm just trying to see if there are any questions from the chat.
I actually have a question for Stacey. It's Talia. Again, one of the things you mentioned when we were talking about this was not only just like how transplant affected you physically, but also just how you, some of your concerns about being different than other people, like not being able to maybe fit in or keep up with people since you've had this experience. So how did you deal with that?
Yeah, so one of the things I struggled most with was probably the fact that once I had the transplant, I was not independent whatsoever for the first year. I had a lot of complications and a lot of issues. And I'm super independent, especially because of the profession I'm in. It's a man's world in this job, and I have to try to, you know, keep up, and I do. So when I came back, it was a really big struggle to make sure I was able to do all the same things that I could do before. And really, I just had to push myself. I had to push myself until I knew, you know, I've hit boundaries where I should probably not push so hard. But realistically, a lot of it was mental with me. A lot of it was just, you know, kind of little kind of conversations with myself. It sounds crazy, but little conversations with myself to say that I haven't changed. You know, I'm the same person that I was. I have the same drive that I did before. And really, I just needed to get myself in better physical shape, because I lost so much muscle mass that I had to get myself in better physical shape. And then it just motivated me. It really just motivated me to try to get better. And I had a lot of friends and family and coworkers that were helping me along the way. I mean, they pushed me to the brink of wanting to punch them in the face. So that helped.
Yeah, and I imagine, you know, you had used the word boundaries, like at times you have to really figure out when you can't, or maybe not can't do things, but when you need to slow down because of your experience.
Yeah. So, I mean, even now, being 5 years into it, I still need to set boundaries. And my coworkers, especially, are very familiar with my boundaries, because if we have a fire and we're out for hours and hours, they know I need to be hydrated, and I'm off doing things and not paying attention. So they're usually throwing water bottles in my face, going, "You need to drink something," or saying, you know, "How's Frank doing? Is he, you know, did you go to the bathroom today? Like, what are you doing?" So I do have a good support system that way, because I don't always look at me first. I usually, especially at work, I'm always there to take care of everybody else. So I do, you know, at least have that system where they have my back, to where if something happens, and they know that I'm usually pretty aware of things. Like even when I travel, I'm aware of where the nearest transplant center is, you know, what my resources are, what pharmacies I need to, you know, keep up with if I need to get my meds for some reason. I mean, I have a whole system down.
And when you meet someone new, is the first thing you tell them is that you had a transplant?
So not usually. I mean, we spend a lot of time, because I've been a medical nightmare for probably as long as I've worked here. Whether there was a diabetic emergency, or I had to go into trauma because when I had a kidney biopsy, my kidney kept bleeding. So like my ambulance that I work for has taken me to the hospital more times than I would like to remember. So usually they like to tell new people all of the wonderful stories of me, and how, you know, we have to give people the pep talk of like what to look out for with me. So it's not usually the first thing, but it always ends up coming out. I have tattoos on my arm of a kidney and of a couple other things that kind of in reference to my transplant. So it always ends up being a topic of conversation, but it's something I'm really proud to talk about, because if other people can help other people, that's what I'm down for that.
Yeah, thank you. So there was a question that I am going to ask to the whole group, or to Stacy, Jessica, and Faith, and it came up in the chat as well. And I'm going to try to apply it to both like intimate relationships as well as just friendships or new relationships. So like say you're a transplant patient, either pre or post, and you're in the space of meeting new people and developing new relationships, whether that be dating relationships or other relationships. And it's a struggle to develop new relationships because of how those people respond. So how do you deal with or kind of move forward when new people in your life, and possibly even other people, are negative about your transplant, and not want to like give up on developing new relationships?
Well, that's a loaded question. So I met a lot of my kind of tribe, actually on Facebook transplant groups. I kind of hope to meet more people through this kind of thing, because I'm like kind of I'm that person that I'll tell you just about anything. Like I had some pretty wicked experiences, and honestly, you know, transplant, although it's a beautiful thing, it's not so sunshine and rainbows. And a lot of people don't want to tell you that, but it's not always so sunshine and rainbows. And I don't mind telling people, you know, what you can expect is the unexpected. So I got to learn a couple people, and got to know some people in some groups, and that was really helpful. But you know, like when you talk to people who aren't so like transplant kind of happy, like they're always kind of weird. Sometimes they get a little weird about it, because they're like, oh, I don't want to talk about that. You just kind of like, I just kind of drop it. Yeah.
How
It
about
depends on the
Jeff
person.
and Faith? Yeah, especially around like developing new relationships or dating relationships.
Sure. I mean, I'm looking at that question and thinking about, you know, somebody say like, oh, that's weird, or, you know, they don't like get it. Like, I mean, first of all, I would be like, okay, great, like, bye, you know, like that's for anything that's, you know, somebody's experience. For somebody else to, you know, say something like that, that's clear that they are like they are not the person to move forward with. But I think that like even, you know, challenging people and saying like, okay, like what's weird about it? Okay, like why do you feel that way? Or what's, you know, like what's behind that? You know, and also, I mean, I maybe it's because I work in transplant and I'm around people that are transplanted all the time. Like I can't imagine why somebody would say that, other than like, or act that way, other than just just ignorance and, you know, not understanding. But I mean, that's not really all that helpful. I mean, I think that like, you know, thinking about those comments and just saying like, okay, like that's somebody else's experience. Like that's not on you. That's not yours. That's not yours to pick up. Like that's their mess that they need to figure out. And, you know, like taking that on as your own is just like, it's just picking up somebody else's, you know, garbage where they need to go and do it themselves. I mean, and I think that like, I think it makes total sense that when you tell other people, you know, that if you're interested in dating somebody or you're interested in meeting somebody, that you tell them about your transplant, because that's important, you know, that's an important piece of who you are. So if somebody is not like willing to hear that, or not willing to, you know, like be, I don't know, be a human, I would say like, you know, you dodged a bullet.
I apologize. I do have to go save a life real quick. So thank you everyone for having me. Tali, if you want to share my email, if anybody wants to talk, let me know, but I have to go quickly. Bye.
Thank you. Bye. Faith, you can actually stop sharing your screen also, and we can see both of your wonderful faces.
So to piggyback off of Jessica, I agree. And I think that goes for beyond transplant and any situation, anything we're going through or experiencing. I think the most we can do while looking for a partner or a support system is just be transparent and find people who can support us for what we're going through, and are willing to be transparent and communicate about it right back with us. So whether it be transplant or anything that you're experiencing in life. I think it's, just important to communicate your needs and what's important and what you've been through.
I also like going back to what Stacey said about like bringing humor into it, like, talking with your friends and sort of like bringing humor into it about like how, like, I mean, I think that's the way to make it sort of like just feel less, disappointing about people. Do you know what I mean? I think that like bringing humor and sort of like sharing it with your friends and just sort of like, making it like, oh, like this person, like, yeah, this is what they're bringing to the table kind of thing. You know what I mean? That's what I think.
Yeah, and I will say, this is Callie again, sorry, because you can't see me, but I can only imagine how hard it is to date in this day and age and just develop new relationships with people, because it's just, it's just hard. But one thing I would suggest, and I try to think about this a lot now with, and talk to families about it and patients, is, going back to what your values are and just identifying and like reminding yourself what are your values, and then what, like how those values would be important, or would those values be important in other people in a relationship with you? Because if you're in any relationship with someone and they don't hold the same values, you're going to have trouble maintaining that relationship. And then the same goes for relationships you already have. I've heard a ton of times from families about how people they've been in relationships with for years, like sisters, brothers, cousins, best friends, don't respond well to their transplant experience. And again, it goes back to like what values you have and what value does the relationship bring to you. And sometimes you have to make hard decisions of, reducing the time you spend with those people because it's not, helping you. I think that's all the questions so far. Unless anyone has any other questions or comments, there's a lot of thank you, and I appreciate everyone for participating. A lot of different experiences. Again, this has been recorded and I'll send it out if anyone's interested. And then, oh, Faith, I thought you had another slide. There is one more slide.
Thank you.
Faith and Jessica.
Sorry.
Yeah, they offered to have a special support group specifically related to this topic, one for patients and one for caregivers, so separate groups in December. So the groups will be focused specifically on, actually, you both want to share really quickly what they'll focus on?
Sure. So we're hoping to have a smaller, more intimate group where your cameras will be on, your mics will be on. So if you are interested in this topic, meaning self-image, self-esteem, intimacy, relationships, and asking more specific questions or hearing feedback from others going through similar situations, we are going to be hosting those on Zoom this December. So you have plenty of time to plan ahead. There will be one specifically for patients that is on the left side of your screen, that QR code. You can scan and it'll take you right to a registration link as well as the Zoom link. And then the other is specifically for transplant caregivers. So that other link will take you right to the registration for that.
And I'm going to be joining in for those support groups as well. And, I'm excited for any questions or any conversations that y'all want to have.
Yeah. I mean, I know it's kind of can feel like awkward to talk about stuff like this, but it really is important. And I can't say enough how much people learn from each other and teach each other. And it really is, a wonderful benefit to be able to connect with other patients and caregivers. So that's it for today. Thanks again for everyone participating. Look out for an email with the recording as well as all of our links and resources. Thank you to Faith and Jessica for participating and sharing their expertise. And then thank you again, Stacy, who had already gotten off unfortunately, but for her sharing her personal story. So everyone, hope you have a wonderful rest of the day, and hopefully we'll see you at our next webinar in September. Thanks.
Thank you, everyone.
Thank you.